Hi everyone, it's Dr. Dave and I am coming back to you with a question that I'm asked about every day in the office, and that is, Dr. Dave, how much should I be exercising? Well, I'm going to tell you right now, this is a very confusing issue and it's a very tough question to answer. And I just want to start this by saying you should always speak with your doctor before starting an exercise regimen, because what I might recommend for one patient may not apply or be safe for another. But it's very easy to get lost in the data and science of exercise. Let me just summarize. Exercise is good, okay? Extreme exercise is probably not good. And like anything, I always think of Goldilocks. You don't want too little and you don't want too much. You want to be right in the middle. So what I usually recommend, and this is what I do myself in my own life, is I recommend 20 minutes of exercise each day, moderate level. How do we define moderate? Well, I usually tell patients you should be exercising at a level where you can have a conversation, but it may become a little difficult. And I think that that's a fairly accurate guideline, and it's a simple guideline. There's too much confusion on what exercise, how much exercise, this exercise, that exercise. 20 minutes a day, moderate exercise where you can still barely have a conversation. And I would also incorporate into the 20 minutes, try to incorporate strength training. Very, very important, especially in men and women as we age, because we do lose muscle mass, something called sarcopenia, which I actually have a video on if you want to look it up. So too much exercise actually is not better and can be detrimental. And studies have shown, in particular with the heart, too much exercise can put somebody at risk for atrial fibrillation, for scarring and damage of the heart, for thickening of the heart and remodeling of the heart, where the heart can actually change shape, and also enlargement of arteries, in particular the aorta, can may predispose somebody to aneurysms. And I'm not saying if you're an extreme exercise person, an extreme endurance athlete, you're going to have these issues, but you have to be mindful that you are going to be at increased risk based on studies that we know of. Now, on the other extreme, you can't be a couch potato. You do want to get up, get out, do something, moderate exercise capacity, 20 minutes a day. All right, everybody, I hope that is clear. I'm trying not to confuse everybody because it is really confusing. All right, one last thing. I partnered with a company called Save a Life. I hope you all went to their website, and I hope you are all CPR certified. Because when somebody is in the middle of a heart attack and they go into cardiac arrest, time is of the essence. And if we can intervene and just perform CPR, sometimes just compressions alone, we may actually save that person's life. So please, please, please become knowledgeable and certified in CPR. And hopefully you'll never have to use it. Okay, everybody, until next time, this is Dr. Dave.